So if you have read and understood, considering it clinical examination station, kindly begin.
Right. A very good morning. I'll first enter the room, smile and wash my hands. Hello, I'm Dr. Shahid, one of the exam candidates.
Yes.
May I confirm your name and date of birth, please?
I'm Tom, 19 years old.
Hi, John. Today I've been asked to examine your ankles and legs. That would include the feeling, touching, and observing it. Are you okay with this?
Yes.
Okay. Would you please take off your gown for the examination?
Okay.
I will start by taking a close look at the ankles first. I will look for scars, sinuses, any swellings and deformities. And then would you please stand up for me?
Yes.
And then I will ask the patient to take a few steps towards the wall, and I will take a few steps. I'll ask him to walk towards me while supporting the patient to prevent him from falling off, during which I'll observe any disturbance in his gait. And I'll inspect the ankle from behind for any scars. Now I will offer the patient to please have a seat again. Please be seated. Now I will be able to feel the. Now I'll be able proceeding to feeling your ankle. Do you have any pain at the moment?
No.
Okay. If you have a pain during the course of, if you have any severe pain during the course of examination, please do let me know. And do you require any analgesics or painkillers for this pain you have right now?
That's all right. You can continue.
Thank you. I'm sorry, so sorry for the pain that you have. Now, initially, I'll start my palpation by looking for the temperature, warmth around the ankle, any tenderness, and any pulsatility. I will also examine the opposite side of the same thing. For the pulse, for the temperature, I'll start feeling from the knee joint with my dorsum of the hands and come downwards. Also, I'll palpate both his, bimanually, I'll palpate both his lateral and medial malleolus and the ankle joint. I'll also palpate for the joint line tenderness if it is there. I will continue my palpations over the foot, over the metatarsal and the proximal phalangeal joints. Now I'll also palpate posteriorly. I'll palpate his tendoachilles and the medial and collateral ligaments if it's possible. Next, I would like to go ahead with the pulsation, palpating for the pulsations of the arteries. I would like to palpate for the dorsal anterior artery, the posterior tibial artery, and the dorsal spurious artery. Then after this, I would like to go ahead and palpate for the movements of the patient. First, initially, I'll ask him to do passive movements, and then I will do the active movements. The passive movements and active movements will be the same. I will be doing asking the patient to do a plantar flexion, that is pushing your foot in the form of a pedal or like an accelerator in a car. Then I will be asking the patient to do dorsiflexion, where I'll be asking the patient to lift his leg up toward the body. Then I'll be asking the patient to turn his feet towards each other, and this will be for inversion. And then I'll ask the patient to turn his feet away from each other. This will be eversion. Now I will, after performing a passive range of movement, I'll also perform the active range of movements, in which I will also look for the patient's face during this examination to look for any grimace or any difficulty or pain while examining. Then after this, I would like to go for special tests. There are 3 special tests in the examination of the ankle joint. First one will be the anterior drawers test. In the anterior drawers test, I'll basically stabilize the lower limb by holding the calf in my left hand, and using my right hand, I'll hold the heel from beneath, and I'll try to move the ankle joint over the. I'll try to move the foot over the tibia or the ankle joint. If there is a significant problem, then there will be an anterior draw test will be positive. It is usually positive in anterior talofibular ligament injuries. The second possible what I will be doing is I will be doing the Talar tilt test. Now, Talar tilt test is I can test for both medial the deltoid ligament and the lateral ligament as well. So basically, I'll be putting the invert stress, where I'll be stressing out on the lateral ligament, in which if the patient has pain, I will identify the patient has lateral ligament injury. I'll be everting the foot again, in which if the patient has an injury to the deltoid ligament, the patient will come for complaint of pain in the deltoid region there. Now, sometimes I can, if I can test for the lateral ligaments, which is anterior talofibular or posterior talofibular, by either in the plantar flexion or dorsiflexion position. After this, I would like to go ahead and do a Simmons test. Basically, in the Simmons test, I'll ask the patient to kneel on a chair, and after kneeling on a chair, I will squeeze his calf muscles. This will result in a plantar flexion of the foot, indicative of a suggestive of a good or a patent or not patent work active tendinophilus. Now this will complete my examination. After this, I'll thank the patient. Thank you, sir, for your cooperation. You may dress now. Do you need any help? After confirmation of this thing, I'll wash my hands, smile at the patient. Thank you.
Okay, can you present your examination now?
This is today I examined a 19-year-old male patient, a 19-year-old basketball player who presented with the emergency with pain and severe pain and agony on his right foot. On examination, the patient has the injury in the lateral ligament, lateral ankle ligament, basically. Negative anterior draws test, and the pulsations are felt normally. There is
So what
no
was
locus
the
of temperature as
positive
such.
finding? How was the gait? How was your
The gait,
inspection?
the
How was
patient,
the palpation? Yes, please.
Yes, the patient had an antalgic
Yes.
gait and have difficult weight bearing on this point. There were no scar sinuses or deformities are noted immediately. There was swelling noted on the lateral aspect of the ankle joint. On palpation, there was a mild local rise of temperature with tenderness over the lateral ligament.
Yes, Talar till test.
The Talar test was positive for a lateral. Talar test was positive for a lateral ligament injury.
Right.
Probably
so
the
what
anterior
are
talus
your
ligament.
differential diagnosis now?
In my major differential diagnosis would be the injury of a calcaneofibular ligament. However, I will also rule out. I'll also have to keep in mind the injuries, the fractures of the lateral malleolus,
Yes,
and the fractures of the fifth metatarsal and cuneiform bones.
all right. How would you confirm your diagnosis? What are the investigations that you'll ask for?
I would initially go ahead and do my clinical examination. To complete my clinical examination, I would basically perform the examination of the knee joint above and a complete neurovascular examination of both limbs.
Good.
And I will continue to do an X-ray of the ankle joint, and I will do an MRI scan if required.
What are the treatment options that you can offer to this patient?
In this patient, I would offer him to have a conservative treatment,
Yes.
considering this to be only a ligamental injury, wherein which I would advise the patient for a complete bed rest for a duration of 4 to 6 weeks with ice, elevation to reduce the edema, and bandage with certain amount of anti-inflammatory and anti-ulcer medications.
All right. If this patient has X-ray comes out and it shows undisplaced fracture of the fibula with the swelling of the ankle, what would be your advice to the patient then?
I would consider the patient to have, again, non-weight bearing, preferably
Yes.
put a slab and give analgesics,
Yes.
rest and elevation.
Good. So according to your opinion, after how long patient should be rehabilitated for before patient can play again?
Probably around 4 to 6 weeks until complete bed rest, and then he can slowly start resuming activities. Probably around 3 to 4 months, after which he can resume play.
6 to 9 months.
6 to 9 months.
Yeah,
Okay.
rehabilitation.